Assalamu alaikum. Today I will be teaching polycystic kidney disease, which is an important congenital kidney disease. It is further divided into adult type and infantile type. First, I will be discussing the adult type of polycystic kidney disease. So first of all, we should know that this is autosomal dominant and it is due to mutations occurring at the chromosome number 4 and 16 in gene encoding the important protein known as polycystin. Polycystin kidney disease gene 1 and 2 are located on chromosomes 4 and 16. And polycystin is an important protein which is involved in the fluid channel regulation in the epithelial cells of the kidney. So, the importance of knowing the gene is because gene loci identification, if done earlier, helps in this screening of polycystic kidney disease in individuals, especially if the disease has been diagnosed in a sibling. Other siblings are also susceptible to develop polycystic kidney disease. So when these cysts develop, they may cause damage to the surrounding renal parenchyma, and as a result of which they may result in end-stage renal disease, ESRD, end-stage renal failure. The kidney stops functioning, and risk factors include early age of presentation. If it is diagnosed earlier, you have an increased risk of developing end-stage renal disease, and hypertension. Early hypertension in individuals can result in end-stage renal failure in polycystic kidney disease, and it is common in males and of African ethnicity. And there is mutation in the AP polycystic kidney gene 1, which is actually the most common gene involved. So cysts can also occur in other organs such as the liver, pancreas, and arachnoid membranes, and seminal vesicles in the males. And this disease is asymptomatic until 30 years of age. And it is the common cause of hypertension in young individuals. And it can also be diagnosed in early 20s or late 20s. But the important thing is that there should be good blood pressure control to prevent renal failure in late stages. So discussing the symptoms, the main symptoms include abdominal pain, hematuria, and a palpable mass in the abdomen. And the most common treatment agents for this disease to prevent the progression of polycystic kidney disease include vasopressin antagonists, somatostatin analogs, and mTOR inhibitors, which prevent the cyst formation, cystogenesis, or cyst expansion, or as a result of which there can be decline in urine function. They basically prevent cystogenesis, which is the cause of decline of urine filtration function or renal function. And other conditions that may be associated with this disease include intracranial aneurysm, subarachnoid hemorrhage, and it can result in increased mortality in young people. The sudden cause of death in young individuals is the rupture of the intracranial aneurysm, which may result in subarachnoid hemorrhage, which can result in early death of people with polycystic kidney disease. Okay, clinical features of the adult type include palpable renal mass, dull flank pain, hematuria infection, hypertension. Hypertension is the most common symptom, and it is because compression causes the increase in renin-angiotensin, as a result of which there is increase in blood pressure. And due to the functional loss of the kidney, there is diluted urine with low specific gravity and polyuria. Uremia may also occur. These are the early symptoms of renal failure associated with nausea, vomiting, and anemia. And other important symptoms which are in the late stages include hydronephrosis, infection, and stone formation. You can memorize this as HIS. Hydronephrosis, infection, and stone formation occur in the late stages of this disease. Okay, the treatment, as you all know, is to preserve the renal function as long as possible. So it is important to have a low protein diet so that the kidney does not have to function more. And fluids, a copious amount of fluids, at least 3 liters per day, must be given to filter the toxins. Infection and hypertension should be treated accordingly. And 2 common surgical procedures are done: Rovsing's operation. Cysts are de-roofed. The roof of the cyst is removed in this operation and the cyst is excised easily then. Renal transplantation can also be done if there is renal failure. But before the treatment, important investigations include ultrasonography, CT scan, and IVU, which is intravenous urogram. And CT scan is considered to be the gold standard in the diagnosis of polycystic kidney disease. So IVU is also done to evaluate the further formation of cysts in the kidney. So what is done in IVU, intravenous urogram? A dye, urographin, is injected in the cubital fossa, which goes to the kidneys via circulation. So the dye gets concentrated in the kidneys, in the ureters, and the urinary bladder. Okay, the dye is then viewed through the X-ray. The lumen of the kidneys, ureters, and urinary bladder is viewed through the X-ray. And the common sign seen in polycystic kidney disease is spiral-like sign, or the Swiss cheesecake sign, cheese sign, or the bell-shaped sign is seen in polycystic kidney disease. Now we will discuss the infantile type, which is autosomal recessive, because of which death can occur within the first 2 months. There is no treatment for this type, as a result of which hepatic and pulmonary fibrosis is the cause of death. Palliative treatment is just given for survival. Thank you.